Hello. Time for yoga. Who is here? If you have access to chat with me, can you please let me know who's here? And I'd also like to know if you have any issues or concerns or things that you'd like to discuss with me. If you are watching this on replay, then some of the information I'm sharing right now might not be valuable to you at that point. Today, I'm actually having a live webinar with an orthopedic surgeon on osteoporosis medications, because what I have found in my work with women is I have so many conversations where women are worried and scared because they are being pressured, bullied into taking medications. They know so little about the different kinds of medications. And more importantly, they don't understand what happens when you start with certain medications, because certain medications that you begin, you cannot just stop. So get yourself educated before you make this big life decision to go on a medication for your bones, because some of them you might be stuck in a years of relationship that you don't want to be in. So educate yourself. And today, the webinar with Dr. Bush, you could find the information on my website, debbierobinson.com, DEBIRobinson.com. And I host webinars all the time. Some of them are free, some are paid. This happens to be one you pay for because it's a deep educational webinar, and you get to ask live Q&A. So you really get a lot of amazing questions asked or answered on the spot, which is invaluable. All right, Beth, how are you? Nice to see that you're here. Anyone want to ask me anything or say anything? Kendall. Well, really interesting, Beth. Kendall, where on your wrist does it hurt? Does it hurt here? Is it tendon? Is it muscular? Is it more related to your thumb, to the joint of the thumb? Because I'm going to say something about arthritis as we age, osteoarthritis. That happens for many of us. Inflammation can show up in your joints, and doing deeper work to find out if you have any gut issues, gut inflammation, food sensitivities, that can all be a part of it as well. So where exactly is it, and what can you do? Plenty of things, because you don't always have to be using your hands. We are doing a posture practice today. And so we're going to use our wrists in some ways. And then I would say to modify. So we'll see how you feel. You'll figure out what the modifications are, and I'll throw some modifications in today's practice for you. So thanks for asking that. Hi, Trisha. I believe you were here last week, right? So welcome back. Carolyn, good morning. Nice to have you here. Were any of you in my live cooking class last night on hormone balance, stronger bones cooking masterclass? So I teach a live cooking class every single month, focusing on bone health and healthy aging. And then I keep the replays in the community that I have called Stronger Bones Lifestyle. If you're not a member of my community, Stronger Bones Lifestyle, I highly recommend it. Really low monthly cost. I've got a live cooking class monthly, and I have 2 Ask Me Anything, 90-minute sessions. One that I run that is specific to bone health or healthy aging, and one that I bring a professional in, and 90% of the time it's a doctor. So you actually have access to ask doctors questions that you're not able to ask your doctor. That's invaluable. So if you're not in my community, Stronger Bones Lifestyle, I highly recommend you join. You could try it out for a week before you make the commitment, and that information's on my website as well. Yeah, okay, good, Beth. So you were able to see the recipes, and that's the thing. So if you don't make it live, you get the replay if you're in the community. People who come and get to sit in, that they don't have that access. So you either can come live, or if you're a member, you get access to the recordings. Good. Yeah, the recipes are good. I took the bean. I made this gigantic bean salad yesterday, which is 10% of our daily calcium need, lots of potassium, almost 25% of our daily potassium, almost half of our daily need of fiber for our gut health, and protein. So it's a really delicious dish. And I took it last night to a concert in the park that I attended, and I got a lot of great comments about it. So Kathy, good morning. Nice to have you here. Well, thanks. I always wonder what all the little like crowns are. I love that. They started to give crowns to all the queens that are here. Mhm. All right. Anybody have anything to say before I go back there? Today we're going to focus on posture because we really need that. So any questions before I go back there? I can't see. I can't see from back there. I can barely see from up here. All right. So, and that's the benefit of attending live. Also, you get to ask me live on the spot. And if you're in the community, I actually show up every day in my community to answer questions. So that's another opportunity for that as well. Okay, so let's begin. This practice will be focused on posture because the big thing, the number one thing, whenever I have a group or a live or I'm teaching a class, whenever I pose the question, especially to those that are diagnosed with osteopenia and especially those diagnosed with osteoporosis, what is your biggest concern about your bone health? And 95+% of the time, it is fracture prevention, or I don't want to break. And so you might not think as much about posture as you do about balance, because balance is critical for fall prevention. But you know, posture plays such a critical role in falling, because for most of us, if we don't pay attention to our head, which we don't, and it's forward throughout the day, and this is another thing that I notice when I teach 5 live classes a week now. At one point I taught 8 live classes, so I teach a lot. I see over 100 people a week, and I have since 2010, so thousands of people. What's always amazing to me is the inclination to look down. So if you think about your head's about 10 pounds. When it is forward of where it should be on your spine, when it is forward, it puts pressure on your spine. There's percentages of the pounds of pressure applied to your spine, depending on how far forward your head is. So even when we do postures like plank and we're on the ground, or all fours and we're on the ground, even those postures, if you have your head hanging down, then that's putting extra weight. It's pulling on the back muscles and contracting to make the front short. And so raising our awareness to being in balance, in alignment in our body is really critical for healthy aging and healthy bones. I just saw an image yesterday of somebody, I cannot remember. Oh, I do remember who it is. It's actually a world figure. I'm just not going to say the name, but it's a world figure in the mindfulness space. And he was sitting on a chair, and I saw his postural position was so crumpled. And I just, because of what I do as a yoga therapist and help people find freedom and strength in their body and move away from pain and discomfort, I thought to myself, that looks painful. And if that's how he is at this age, what's the next 10 or 20 years going to look like in his body? So you want to stop the breakdown. You want to maintain that aligned position. In yoga, the posture is called mountain or Tadasana, where we try to find this aligned position where you have your joints stacked, your ankle, your knee, your hip, your pelvis, your spine, and your head. So we want to work on raising awareness. In today's practice, in this sequence, you're going to focus on different aspects of that. So make sure you have what you need. You need a chair. We're going to use the chair. We're going to sit in the chair for part of the practice. And you'll need a block and a strap and a blanket. And if you don't have those precise props, get things that look like that. Towels are a great strap. Towels rolled up could be a block. So there's no excuses. You don't have to have these exact props. And definitely get a chair. Now with a chair, if you could get a chair that has no arms, that's even better. So if you get a chair with no arms, there's things that we're going to be doing in the chair that are going to be supportive of posture that will be very helpful. So grab a chair without arms. And of course, if all you have right now is a chair with arms, I'll give some modifications. So go ahead and get whatever you need. Okay, so we're going to begin the practice. Yoga is a mind-body practice, and the more body aware you are, the more in tune you are with your body, the stronger and safer you could stay when you do practice. You know, the relationship between muscles and bones, you cannot have stronger bones without stronger muscles. So the focus has to be that we build our muscle tissue. And in order to do that, we need to do hard things. We need to push and pull and manage weight resistance in our body. And in order to do that, if you are in a really great mind-body connection, you could be so in tune to know that, yes, I'm in alignment. Yes, this is appropriate pressure. So we're going to begin on the ground. We're going to do legs up the chair. This chair also has no back, so I'm going to put my feet through the chair. The key with legs up the chair is that you get your entire calf to be supported and that the back of the chair comes back up to where your calf is. So if you have a chair that does not have an opening at the back, you might want to put your chair to the side so your legs can go this way and your feet can hang off. You need a place for your feet to hang off. It's either going to be out the back or it'll be to the sides. And then we're going to put a blanket underneath our heads, and that really is dependent on your body and where you are from a postural perspective. So before we go down, let's do a little posture assessment. Let's see if there is any rounding that lives in your upper spine, right? If the thoracic spine where the ribs are attached, if that has any rounding in it, the term is called kyphosis. That's that hunchback look. And what's going to happen is your head is going to be sitting forward and all these muscles developed in calcifications in your spine in order to manage your head being forward like that. So let's do a little posture assessment before we come on the ground. So for this, you'll need a wall. You could do it in a door, but a wall would be ideal. So I would like you to come up to the wall, and your feet could be a few inches away from the wall. You want to get to the place where the sacrum, which is the middle of the pelvis, touches the wall. So try to get your buttocks, the center of your tushy, the back, to touch the wall. Then you want your shoulder blades, which is behind your heart, to touch the wall. And then you want your head to touch the wall. Your chin is parallel to the ground. Your eyes are straight forward. And then you bring your arms onto the wall. So try that. See where you are with this. So can you get sacrum, shoulder blades, center of the head to touch? Make sure that your chin is not up towards the sky. If you're doing that, it's because your head is living in that forward position and your body has actually created muscle and bone attributes to balance your head that far forward. Not to worry, in most cases, it's correctable. So from here, to see how nice and aligned your spine is, start to slide the arms up, keeping the wrists on the wall and the backs of the hands on the wall. See if you could do this. And if you can't, that's okay. You could practice. In this practice, doing some posture work, that'll be a part of it. So what happens is the front of the body gets tight and the back of the body loses its tone. It gets overstretched and it can't be efficient and effective muscularly to hold you in a nice aligned position. So from here, can you bend your elbows? And what you want to make sure you do here is don't let your hands come closer to your head than your elbows. So push them away. And then I want you to look side to side, try to get your wrists to touch. So notice if your wrists have flown away and you bent your wrist to try to make this happen. So get this here, chin parallel. So the center of the buttocks, push your belly button towards your spine if your low back is not happy. Push your shoulder blades towards the wall and then push the center of your head towards the wall. And now your arms are pressing in. The elbows, the forearms, the wrists, and the backs of the hands. And then stay here for a minute or two. Notice where you start to feel tension. So some of the places you may notice is, you may notice a burning or a muscular sensation in between the shoulder blades. You might notice a burning or muscular sensation along the sides of your neck. You might notice it on one side more than the other, especially if you do have any kind of curvature in your spine. If you have a diagnosis of scoliosis or curvature. And functional scoliosis is something that develops in many as they age and mostly women. So just pay attention here. This is a posture assessment so that you'll notice, because when you notice what's happening, that's when you can work on it. So notice here, is there one side tighter than the other? Push your arms into the wall, push your wrists into the wall, push the backs of the hands. You're going to notice whatever's working in order to get this aligned position. Push your belly button to your spine to protect your low back. And take one more breath. And then go ahead slowly and bring yourself out. Now that is a self-assessment of posture. So along the sides of the neck, you might feel the muscles. You may feel that in between the shoulder blades at the back, so that the back would be working and strengthening to hold you up. And then if you feel the pressure here, you feel the pull on the shoulders in the front, that's the tightness of your body trying to hold your head instead of it being in that aligned position. So really important that you take stock of that throughout the years and work on whatever you need to work on to strengthen, to make sure that you strengthen the muscles that need to strengthen to support posture and lengthen and open up the front of the body so that you can find that proper alignment in your body. So now let's go down on the ground and arrive and allow our pelvis to relax, allow whatever needs to relax. So one of the things too is getting up and down off the floor. One way to do this is with a wall or with a chair. Let's take a big step. And if you do know that you have a weaker side, then try the weaker side. So if you know that you have a weaker side, bring the weaker side leg forward. And typically, whatever leg is forward, it's better to have that one near the chair. So this is my right leg, and my right leg happens to be my strongest because my left side is my hip replacement. So if I were going to try it the other way, I would do this, and I would put my left leg forward and my right leg back with a big stance and have the chair there to feel that. And then as you load down onto the ground, you have the chair there to support you. And as you lower down into the joints of the knee in particular, and you lower down into your body, you're actually strengthening the joints along the way, because that's where we lose the strength to be able to get up and down off of the floor, is we lose the strength in the function of bending our joints. So if you have trouble getting up or down off the floor, it's because you've lost the strength of your knee joint in this bent position, or this bent position, or this bent position. So it doesn't mean that you'll never get that back. It means you raise awareness to that and you work on that, because that becomes a confidence piece that we need for happy and aging and a good quality of life. So bring your blanket to the back of your mat, and then we're going to come down. I like to come down first and then put my legs up. So bring your pelvis as close to the chair as you can, and then bring yourself onto the ground. You could always readjust the blanket. That's an easy thing to readjust. And then you bring your legs onto the chair, so you want your entire lower leg bones to be supported by the chair. Let your feet hang off. If you have a space at the back, great. If you don't, turn your chair to the side. And then if you are supporting your head, do it with a small folded blanket, or you can even explore no blanket. And then in this, you could do a little posture correction. Now, this actually helps to correct posture because you have this gentle pressure of gravity pressing down on you. If you don't put too much underneath your head, this can actually have posture corrective aspects of the upper body. And it's nice and relaxing and relieving of the tension that can happen in the low back. So press your arms into the ground and your head. Lift your rib cage up and slide your shoulder blades closer together. Then push your feet into the floor, lift your pelvis up. So get a nice long spine at the back. And then you bring your arms out at the side. So either straight out at the side or bend the elbows. Make sure your hands are farther away from your body than your elbow. So this distance here from elbow to shoulder, you want your hands to be farther away. Don't let your hands be closer to your body. That's something that I notice in my live classes that I teach. Take your arms out to the side, lift your head, lengthen your neck, tuck your chin towards your chest. Then close your eyes and let your awareness go up and down your body here to notice what you notice. Notice if you need adjusting. Notice if it feels appropriate. And then notice in the neck if there is any tension or any sensations that are developing in your neck or your upper back from this position. And then not to be distracted by any tension that exists in the neck, let's do a couple of neck rolls side to side to warm up the cervical spine or the spine that's in your neck. Take an inhale. As you exhale, slowly let your head move in one direction. Inhale back up to center. Exhale in the other direction. Inhale back up to center. Exhale the other direction and back to center. And what I'd like you to focus on is the back of your head is making a shape. It's the shape of an arc, a rainbow. See if you could feel that. The weight of your head is going side to side. And then bring yourself back to center. Noticing what you notice. So when we talk about posture, we'll talk about the spine. So there's 7 vertebrae in your cervical spine, your neck, starting at the base of the skull to the top of the rib cage. So as you breathe in, keep your mouth closed, breathe into your neck. Feel your neck expand out to the sides, front, back, and top and bottom. So with each breath, you feel this expansiveness in the neck area. Take one more breath. That was 3 breaths we took to the cervical spine. Let's take 3 slow, long, deep breaths to the thoracic spine. There's 12 vertebrae, starting at the top of the rib cage, going down right around the belly button area is where the thoracic spine is. 12 vertebrae. So breathing with awareness to this part of your spine, let's take 3 long, deep breaths to the thoracic spine. The lower back spine is called the lumbar spine. It's the largest part of the spine in terms of size of the bones. There's 5 vertebrae here. Bring your awareness to this part of your spine, 3 long, deep breaths to this part of your spine. Now bring your awareness to your tailbone and the sacrum, the last part of the spine that's embedded in the pelvis. 3 long, deep, slow breaths to the base of your spine, your sacrum and your tailbone in your pelvis. Now for these next 3 breaths, we're going to start at the base of the tailbone. As you inhale, bring your awareness all the way up from the tailbone to the sacrum, to the 5 low back bones, the lumbar spine, the 12 thoracic bones where the ribs are attached, the 7 bones of the cervical spine. That's your entire inhale. And on your exhale, let your awareness go all the way back down to the tailbone for the next breath. 3 breaths this way. Take a big exhale and begin. Slowly exhale. Inhale, tailbone, sacrum, lumbar spine, thoracic spine, cervical spine. Slowly exhale. Last one, tailbone, sacrum, lumbar spine, thoracic spine, cervical spine, and exhale. Bringing your awareness to your fingers and toes. Wiggle your fingers and toes. Let your arms go up in the air. Roll your wrists. Open and close your hands. Move your fingers. Articulate the joints of the hands. Make sure the thumb is bending with 2 joints, and each finger is bending all 3 joints. Keep your arms up in the air. Let gravity bring the fluids down towards the heart. And then walk the feet closer to you, the knees closer to you. Let's bring the feet up into the air. Shake the legs. Let the legs settle. Let the hips sink deep into the pelvis. Point the feet. Flex. Point. Flex. And then circles in one direction. Circles in the other direction. And draw the knees into your chest and rock your body back and forth, side to side. Bring yourself onto your side. Now, when it comes to posture, our daily movements are what contributes to how are we standing, how are we sitting, how are we moving. So if you do a postural assessment of yourself at a wall, and you notice that your head is forward, that you might have surrounding in your thoracic spine, then the way you move every day, you start to bring your awareness to it, and that's how you move backwards, back towards perfect alignment in your spine, which is safer for the bones. So here's one time. Getting up off the floor is one of the ways you could practice not using your back muscles in the wrong way, but rather keeping the powerful pectorals, which are the chest muscles, which are some of the important front body muscles for posture. So I want you to keep your head on your arm, cradle your head in your arm, and you're going to try to push yourself up, keeping your head and your arm attached. You could kick the top leg away, really pushing with the elbow and pushing with the hand, ensuring that you're using those upper body muscles more effectively and efficiently, and not using the back muscles in the way that you might have defaulted to subconsciously. So raising awareness is a really important aspect when it comes to posture and alignment and everything that we do throughout the day. So we're going to come up to standing to do some chair work for posture. This is a perfect opportunity to practice getting up and down, to load your joints in different areas, slowly coming up. And one thing I want to say is this: the slower you move, the deeper you go, and the longer you stay is how you will develop stronger muscles, stronger joints, stronger bones, better balance, better posture, better alignment, healthier aging. So go slow. The inclination is to go quick. And if you go quick, more often than not, you develop dysfunctional movement patterns in your joints. So go slow, notice, and if it comes up for you, oh wow, this is hard, or you notice that you're going faster than you should, just bring this awareness in, because every day you have the opportunity to work on strengthening your body and your bones. So bring a blanket here. We're going to practice getting up and down off the floor. Having a chair is really important. Whatever leg is near the chair, you bring that leg forward. Now here, this flexion or bend in the joint and bend in the hip, This is a 90-90. That is a very hard place to be in your joints. Even those young whippersnippers in their 30s in the yoga classes are not in the 90-90 in some of the postures like warrior two, side angle, and some of the standing postures, because it requires so much strength to be here. So here you are, and you're gonna move up from out of that, which is what makes it really hard. So take your back foot and flip your back toes under. Take your hand on the chair. Now, if you know that you need even more assistance, you know that this is really a challenge for you, what you could do is actually make this a little taller for yourself and put a block on the chair so you have even more force to push down from a higher place. We're going to be using the upper body here to assist if we need that. And then moving away from using that assistance maybe might be something that's in your future, maybe not, doesn't matter, it is what it is. So take the back foot, flip the back foot under, and then bring your hands on your waist, nice and tall in your spine. And I want you to look forward and up, not forward and down. If you go forward and down, you're giving your body extra work to do. So forward and up, and then you're gonna flip the back toes under. You could use your hand on that block. Bring yourself forward first and activate your glutes. Make sure that your ankle is under your knee or forward of your knee. Activate your glutes. So push that front foot into the floor, feel that back buttock activate, and see if you could lift up and then go back down. And lift up and go back down. And then one more, bring yourself up and go back down. So that was one side. Let's do that on the other side. And I'm going to tell you that as we move on in this life, as we age, this motion becomes very challenging. And this is what usually makes people come to my chair yoga class and not be able to do my floor or mat yoga classes, because they have lost that ability to get up and down off of the ground. And then it becomes very scary, especially if you live alone or you are alone at different times in your house. You get very worried that you might fall and you won't be able to get up off the ground. So we want to mitigate that fear, do what we can to keep that strength in our joints. Really, really important for bone health and not focused on often enough. So now we have the opportunity to do this. Flip the back toe under. You can press down on this if you'd like. Hand at the waist, elbow back is going to put your shoulder blade on your back and keep you in a nice aligned position. Looking forward and up. Come forward first, weight bear, turn on that front glute, big, big, big power muscle to help you lift up and down, up and down. And on this next one, we're going to come up. Now here you are. So you're going to have to push yourself forward. I want you to look forward and up and see yourself moving forward and up to come all the way up. All right, let's clear the space. So we're going to use the block and the strap. So bring your chair onto the mat and the strap and block nearby. Now, when you are putting a chair on the mat, one thing I want to say is this. You need to have, you want for fall prevention, we want to make sure that we have the chair on the mat. So at the very minimum, have 2 of the legs of the chair on the mat, or you could have all of the legs of the chair on the mat. So make sure that you have some connection. That's really important. And then bring yourself here. Let's lower down into the chair nicely. Take your legs wide. Let's do a squat to get down to the chair. So you could have your hands, actually having your hands forward will help counterbalance the weight, because I'd like you to push your weight back as you lower down. Now watch the knees. Don't let the knees cave in. That's weakness in the lateral chain of the side body. Push the knees out. Push yourself back and down. Feel the glutes activate when you do this, and then you come all the way down into the chair. If that's a challenge for you, put a bolster or pillows on the chair so you have less distance to go, because that is more of that joint loading and unloading. And actually doing this, practicing getting up and down, is actually another way to keep the leg muscles strong, to keep the knees functional, to keep the hip joint functional. And when you're doing this, make sure this doesn't happen. That's really important. So keep pushing those knees wide. If you push the knees wide, you sit back, activate your glutes, you're going to feel that work. And there's studies that's done on squatting. And there's a new study that came out that said Every hour, 10 squats is very effective at maintaining lower body strength and regulating blood sugar. So that internal balance that's important for optimal health, including bone health, is also something that you can achieve by doing this squat. So that up and down off the chair like that is squatting, and it's a really great thing to practice. So let's start to warm up the body on the chair. Bring yourself onto the chair and come forward in the chair, and then put one buttock back at a time so that you feel the back of your body touch the chair before you feel the top of your body. And that's important. If you pay attention, this is something that I do, it might be something you start to do, but for many of us, we come to a chair and we slouch in the chair. So if you look at this part of your body, it's far away from the back of the chair because what you're supporting is this part right behind your heart. And what shape is this supporting? It's supporting this. That's what it's supporting. So we want to come to the chair and take your tushy back one at a time so that your pelvis is right underneath you, your spine in this alignment. And in some cases, for many of you, you might not even need to touch the back of the chair with the other part of your body. So try that. Bringing your tushy all the way back. Feel the back of the chair touching your body. Then bring yourself here. And take your elbows underneath your shoulders, palms are up. If you are able to sit a little bit, not at the back of the chair, try that. Let's begin warming up our spine, starting with our cervical spine. Because for alignment and posture, the parts of the spine, 7 bones in the neck, 12 where the ribs are attached, and 5 in the low back. So take your palms up, elbows underneath your shoulders. Let's take rotation first. So chin is parallel, push your head back. Inhale to look over one shoulder, exhale back. Inhale the other shoulder, exhale back. Inhale and exhale back. You could close your eyes, do a couple more. Feel that stretch. And bring yourself back to center. The next one is side bending. We're going to stretch from the lower, or for the side of the neck by the ear down to where the shoulder is. So imagine you're talking to someone on an old-fashioned phone where you had to bring your shoulder up to your ear to hold the phone if you couldn't hold it with your hands, and then drop the shoulder. Allow the head to still be bent over to the side. That's your inhale. As you exhale, come back up to center, and then inhale the other side as if you were holding a phone. Let that side neck stretch now, and then back up to center. Side, inhaling into the stretch, back up, inhale into the stretch, and back up to center. One more each side. This is lateral flexion of the cervical spine. A lot of tension here. When it comes to posture, bring yourself back to center. Teeth are together. You're going to exhale, bring your chin down and push it back. That's your exhale. Feel that stretch on this up and down the back of the neck. Teeth are together. Inhale, chin up towards the sky. Exhale down. Inhale up. Down and up. Last one. Bring yourself forward. Let's do the whole spine. The first one we're going to do is flexion and extension. So flexion, bending the spine forward would look like this. And it is the major no-no to do for osteoporosis is to not bend your spine. Any bending forward needs to take place in our hip joint. So doing the warm-up, you could flex the low back. So start by rocking your pelvis forward and backwards. There are actually the sits bones that you're sitting on are curved like rocking chair legs. And a great visual to get this, imagine your pelvis is a basin of water. And you are tipping the water forward. If you tip the basin forward, the water spills out the front edge. If you tilt your pelvis backwards, the water spills out the back edge. So you tilt your pelvis forward, you tilt your pelvis backwards, forward and backwards. If you look at my body, I'm not going forward and backwards with my torso. I'm keeping my rib cage and head stationary, and I'm moving the lower body, the pelvis separately from the rib cage. Takes a little while sometimes to get this. You're gonna feel the low back muscles stretch, the muscles underneath the rib cage and on top of the pelvis. When you do the backward movement, it stretches low back muscles, forward and back. When you tilt the water back, that's flexion in the lumbar spine. It's a little relieving, but you don't want to bring that to the thoracic because that would bring in the rounding. So let's inhale, elbows go back, throat opens, you stretch the front of your spine, looking forward and up. This is your inhalation. As you exhale, let your hands come forward, stay tall, don't slouch, tilt your pelvis back, and let the water come out the top back edge of the pelvis. Inhale forward, exhale back. Inhale forward, exhale back. Forward and back. This is called flexion in the lumbar spine and extension or a back bend. Come into the extension, the back bend. The elbows are back. The front of your spine is being stretched. The throat is open. You're looking forward and up. Push the shoulders away from your ears. Slide the shoulder blades towards each other. Feel this. Feel the action in the back of the body and then the stretch in the front of the body. Take one more breath here. And then bring yourself back to neutral. Next, we're going to bend our spine side to side. It's called lateral flexion. This is the next two movements of the spine. Bring your body forward. So you're at the front of your chair. You're not resting at the back of your chair. When you sit away from the back of your chair, you give your back muscles work to do. So we are activating postural muscles here. Take one hand on the side of the chair, the opposite hand palm up. You're going to inhale up. Keep your arm alongside your ear. So the arm should be right by your ear. You're not trying to go far over and bend your body forward and look down at the ground. That's not what we're trying to do. We're going to bend the side of our spine. So you're going to inhale up, hand moves up towards the sky, and then flex your wrists. This makes it a little more intense when it comes to stretching the lateral chain or the side body. You inhale up and exhale out. Inhale and exhale. And then one more, you're going to come up, bend your elbow, put your hand behind your head, lengthen your chest. Look in front of that elbow up towards the sky. Keep pushing that elbow back and push into the opposite hand so you stay nice and tall in your spine. You don't slouch here. Elbow up, bending and lengthening the side of your body. This is for spinal health, for posture, for alignment. Take one more breath and then bring yourself back up to neutral. Let's go to the other side. Take your hand to the side, the palm is up. You're going to inhale up. Keep your arm alongside your ear. Don't let it go forward. Keep it alongside your ear and back. And if that means that you only go to here, only go to there. Flex that wrist. Let's take one more. Flexing your wrist, you're right at your ear, and then you're going to bend the elbow, push the elbow back, turn your head towards the elbow, and look up towards the sky and see if you can point the elbow up a little bit more, and press the left hand into the chair, lengthen your spine, lift your heart. Stay tall in your spine here. Take one more breath. And then bring yourself up, bring yourself out, come all the way out. The last movement for the spine is rotation. Rotation is one of the best ways to keep your spine healthy, and you need to do it correctly. You do not want to be flexed forward and rotated. You don't want to rotate side to side if you're rounding your spine. You need to be sitting upright, have a nice open, long front spine. This is where all the fractures are in osteoporosis, from thoracic 8, 9, 10, 11, 12, lumbar 1 and 2, right here. And if you are collapsing this area and then rotating, that's a no-no. You're putting on that pressure, compressive force in the front of your spine. So stay tall, maintain your safe spinal space. Put your hand underneath your heart, your other hand at your belly. There's 7 vertebrae here. We do not want to compress the front. We want to keep them nice and long. So bring your hands now onto your thighs, palms are down. Let's start with the head. Inhale, look up into the side, and then back to center. Go slow and go as far as you can in your range of motion. We're stretching the muscles of posture and alignment. Inhale, look up. If your top torso goes, let it go. That's a safety valve. These are the muscles that attach to the base of the skull and the top of the rib cage. They're the muscles that maintain holding that head of yours on top of your body. So inhale into the stretch, looking up and over. One more like this. Now we're gonna go a little deeper. As you inhale, let your elbow go back, let the other opposite hand go forward. So the direction you're going in, the elbow goes back. That's gonna keep you safe, keep you nice and tall in your posture. That's your inhale. Exhale back to neutral. Inhale the other direction. Your hands are acting like pistons and they're acting like protection. As that elbow goes back, keeping that shoulder blade on the upper spine, preventing you from flexing in your spine as you add rotational force to your trunk. Now, believe it or not, this is core work because these are rotational trunk muscles. They're stabilizers, they're core muscles, posture muscles, spine muscles. You inhale into the stretch, you exhale back, inhale to the other side, and then bring yourself back. So that's the 6 movements of the spine: flexion, extension, lateral flexion side to side, and rotation one direction and then the other. 6 movements of the spine. Let's move into warming up the shoulders. Now the shoulders, we have a shoulder joint and we have a shoulder girdle. We have 2 parts to our skeleton. You have the head, the spine, the rib cage, pelvis, and legs. That's the axial skeleton. You have the appendicular skeleton, which is the clavicle bones, the scapula, which are your shoulder blades, and your arm bones. So this part of your skeleton is separate, and the shoulder girdle is when you move the whole skeleton, the appendicular skeleton, as one unit and not just the joint itself. So even if you have shoulder issues, this is a way to safely warm up the entire shoulder girdle and not just be in that joint. So push your shoulders forward, so far forward that you feel a stretch somewhere. We're not just casually putting a little bit, a little bit, a little bit. Go to your range of motion that you feel a pretty substantial stretch. You're separating the shoulder blades, spreading the upper back muscles, stretching them forward, up, back, and push them down. Push those shoulder blades down towards the back edge of the pelvis. Push the shoulders forward, spread them as much as possible, up, back, and down. Forward, up, back, and down. Now you may hear crunchy stuff. You may feel congestion, cobwebs that develop in the tissues of your postural muscles, the upper body muscles. As long as there's no pain, you're clearing the cobwebs. Forward, back, up, and down. Let's go the other way. So push back, push up, push forward, push down. Back, up, forward, and down. Back, up, forward, and down. And turn this into a circle. Back, up, forward, and down. Back, up, forward, and down. And then bring yourself back. So those are shoulder circles. And if you do them with a lot of muscular movement, you're going to feel the heat and the movement that you're creating. And in that process, you're clearing the congestion or the cobwebs or the obstruction of flow in the postural muscles in the upper body. Now let's do that same thing, the shoulder. Now we're going to do the shoulder girdle again. Take your hands on your shoulders. Now the rotator cuff is actually 4 tendons that attach the shoulder here. So we're going to make our own rotator cuff by bringing these 4, the thumb and the first 3 fingers, to your shoulders. Start to go up on the inhale and down on the exhale. Now, again, we're not just casually doing this. I want you to use as much muscle as possible and in as best of a posturally aligned position as possible. Imagine you're up against a wall and your arms are going up and down as if you were right alongside your body. If you look forward, you shouldn't see your arms because they're not forward. They're not even in your peripheral view. So keep pushing them back and imagine you're sliding up and down. Using those muscles, the levator scapulae that lift up the shoulder bone in the back of your body. One more. Now you're going to bring the shoulders down, bring the elbows forward, push them forward as much as you can. Take an exhale, and let's begin the breath with this. Inhale, let your elbows come up towards each other. Bring them up to the sky all the way, and then bring them out and around as far as you can. Start your exhale when your elbows go down and let your chin come to your chest. The inhale begins when your elbows are down and you start to rise them up to the ceiling. When they go out to the sides and they start to go down, you begin your exhale on the downward movement. Inhale in the upward movement. Exhale down. Inhale up. One more. And bring yourself down. Close your eyes. Feel and notice what you're noticing. And then open your eyes. So in that movement there, if you're doing this with a lot of effort, as if you're in a vat of honey and you're moving your arms through honey with resistance, you're going to feel muscular action there when you do this. And then when you're doing your head position and doing flexion and extension in the cervical spine, you're going to feel that stretch in the upper back, feel that stretch in the front of the neck. So let's move on. So the rotator cuff, these 4 tendons that attach the shoulders, having this area nice and flowing and limber and strong is what's really important for posture. And this is an area that a lot of breakdown occurs as we age. It's one of the areas I've noticed over the years in my teaching that when I ask if there's any issues, this is an area a lot of people have issues is in the shoulders. And it's because everything we do all day is forward. Our hands are forward. Cooking, knitting, reading, gardening, texting, on the computer, whatever it is. So that forward position, which we find ourselves in so often, bringing that shoulder joint forward, the weight of the arms forward, tip of the head forward, is going to put a lot of pressure here in the body. So let's unwind that so we can find that nice aligned position. The better aligned your joints are, the less wear and tear, the less arthritis develops, the less pain develops. And that is what is a goal for all of us. So let's do a little warm-up sequence for the rotator cuff. Take your elbows in alongside your body, bring your hands at the side, palms are facing each other. And then let's inhale, keep your elbows in at your body. Don't let them go out to the sides, keep them in. You're gonna inhale, open as far as you can. Look forward, but I want you to feel in your body. Does the right hand move more than the left, or does the left move more evenly than the right? And then crisscross your hands opposite direction when you come forward. You inhale to open, exhale to come back. One more. Bring yourself to the open position. Keep your arms here in the open position. Elbows are in at your body. Keep your arms open. And then imagine you're sliding this pinky edge of your hand across a table. Inhale to slide across and then back. Keep your arms at the side of your body. And it's really good to do this in front of a mirror where you can actually see your position. Make sure your hands aren't up here, but you're at that 90-degree angle beginning in your elbow joint. You inhale away, you exhale back. And then bring your arms here. Now we're going to make, so this is like the shape of the letter L. This is also like a shape of a letter L. Now let's go into shape of the letter W. Keeping the elbows bent, you're going to inhale up and bring the elbows down to the waist. So you move away from the waist at the sides of your body. If you were on, your back was up against a wall, your hands would be sliding along the wall. So don't let your hands come forward. Try to push them back as much as you can, working those back muscles, the posture muscles. Inhale and exhale. You'll feel this in the back of your body. The lats, the rhomboids, the traps are all getting worked. And these are posture muscles that help to hold you upright. I call it your hanger. Strengthen your hanger so you hold yourself upright throughout the day. This one more W, and then bring your hands down for a second, especially if you're feeling a tension in the back of your body, you need a little rest, you could take a little rest. So that was the W, now we're gonna go to the Y. You're gonna inhale to the Y, unbending your elbows, try not to keep your arms forward, try to push them back to the sides as much as you can, and then bend your elbows down to your waist. Inhale and exhale. Your gaze is up, your heart is lifted, and it helps if you look across the room 3/4 of the way up the wall. When the head is in this position, you activate those upper back muscles, you put your head back on top of your spine, and you give your body the work to do while you're practicing strengthening your posture and your alignment in your spine. One more. Stay here with your arms up. Now push your arms back, look forward. Try not to be able to see your arms at all because they're so far back. If your low back is not happy, push your belly button to your spine, tilt your pelvis back like you're trying to spill water out the back edge of your pelvis. Keep your arms here. Take one more breath. And then bring your hands down. This is weight bearing. We need to do weight bearing exercises when it comes to bone health. Holding the weight of your arm bones against gravity is a lot of weight for the upper back muscles to manage, for the pectorals to manage, for the deltoids to manage. And hopefully you're doing this slowly and to your maximum range of motion to actually feel the work that's happening here and the work in strengthening the muscles. So let's use the strap. Now, there's an inner teacher and intelligence that exists in all of us. And even if I'm guiding you, you'll see what I'm doing, and the inner intelligence that inside of you will say, oh, no way, I can't do that. Or, oh, I'm not gonna be able to do it like that. So listen to whatever that is, especially if you have shoulder issues. We're doing a lot here with the shoulders and the upper back muscles. So I'd like you to take your strap, and if you don't have a strap, a towel, something that you can pull on to get tension. And so bring your hands so that they're only about a foot apart. Bring your hands to be about a foot apart. And then you're gonna bring the strap so it's up above your head. Pull on that strap to get tension. Push the elbows out to the side. Inhale. As you exhale, pull on the strap and slide the strap down the back. Don't let your strap graze your head. You exhale, pushing the strap down. You're pushing the shoulder blades down your back. You inhale up only to about the top of your head, and you exhale down. Don't let the strap touch your head. So push it back and pull on the strap and push it down. Getting a little bit more force on those upper back muscles. Hopefully you feel some heat. Don't let your head turn down. So your gaze is straight forward. Your neck is parallel. Your chin is parallel towards the ground. And then you're going to do one more like this. Come down, keep your strap pulling lots of tension, or a blanket, whatever you have, and push the strap away. Don't let it rest on your head. Don't let it rest on your neck. Push your elbows away. Slide the shoulder blades towards each other and push the shoulder blades down towards the top edge of your pelvis. Pull on the strap, push your elbows back, strengthening your upper back, strengthening your upper body, your postural muscles, your spinal muscles. Take one more breath. And then bring yourself out, let your strap rest. Take that tension out. Shoulder rolls forward, up, back, and down. Forward, up, back, and down. And then bring yourself to rest. So get a strap and let's do a stretch. and determine if this is appropriate for you. If you have a torn rotator cuff, you have issues in your shoulders, it might not be the best thing for you. This might be something you skip. And you will know because you'll look at this. There's an inner intelligence that happens to those of us that have been injured. I've had a hip replacement. So I look at something and I'm saying, yes, I'll do it, or no, I won't. Jumping up on things is something I will not do with my hip replacement. My inner intelligence tells me that's not a good move for my hip. So is this a good move for your shoulders? You want your strap to be as long as you can. So take your arms as wide as possible. Bring the strap forward and then bring the strap up, back, and down with straight arms. No bend in the elbows. Maybe it's for you and maybe not. Matching the breath with this, you're going to inhale up, exhale back. Inhale up, exhale back. And on the last one, you're going to bring yourself up. Now I want you to look up across the room where the wall and the ceiling meets, and I want you to imagine that you're holding a sheet in the wind, and the wind is blowing back, so the strap moves up and back, your chest opens, press your heart forward, try to tip water out the back of your pelvis, push your belly button towards your spine to protect your lower back. Take one more breath, and then go ahead and release. So get your block, and this is some shoulder work, some resistance. You know, resistance is part of what keeps us strong when it comes to our bone health. Weight bearing is important, but we also have to resist. We have to resist the breakdown in our joints, in our tissues, in our muscles, and in our bones. So take a hold of your block. You're going to inhale to lift up, exhale to lower. Inhale and exhale. And if you do this in a mirror, what you're going to notice is, where is the tension? So do you come up at an angle? Do you come up straight? Can you keep your elbows straight? So it's a little self-inquiry into tension or tightness that exists in your upper body. And then one more. And hold the block up here. Now you're not grabbing it with your fingers, you're pressing into it. You're trying to keep your arms straight. Notice here what you notice. Try to tilt your pelvis back as if you were spilling water out the back edge. Push your belly button towards your spine. Press the block. Press, press, press. Take one more breath. And then bring yourself down. All that tension that's created, shoulder rolls in between, can be nice and relieving. So let's take a block for this next one. Take the block and bring the block between your forearms, and don't hold on to it. Put the block between your forearms. Try to get your elbows to be pressing into the block as well. If you don't have a block, you can use a towel. Let the block come down, and then let the block go up. Down and up. Some more shoulder work. Inhale up. Exhale down. Don't let your head go down. Keep your head forward. Head is looking forward. One more. And then bring yourself out. Notice all that work. Different postural muscles. Shoulder rolls to take tension out. So let's do a aligned body, challenging our lower body. So we want our spine to be nice and strong. We want to work on strengthening our trunk. That's really important. And then you also need to have a strong pelvis, strong back, strong core area. So let's take our block and our strap and do a chair posture. We're in a chair. It's great to do chair in a chair. So I'm going to turn my chair to the side so you can see. We're going to create angles in our joints and then challenge ourselves. So take your block and bring your block. I'm doing the block at the narrow way through my knees. One thing I want you to make sure is that your feet are pointing forward. You don't have your lower legs wider than your knees. So walk your feet so that they're only block distance, which is about 4 inches here. And you're gonna come to the very, very front edge of the chair. Go back and forth so you feel the buttocks on the chair. Take your block, so your block is in between your knees. And then take your strap. Now, 2 choices here. You could actually take a loop and let it be a little bit wide here. So you want the strap to be wide, or you could hold on to the strap for your upper body to get your upper body to be activated here, since we're focusing a lot on posture. Then you're all the way at the front edge of your chair. And I want you to walk your feet back closer to your chair. So your feet are behind your knees here. Your arms are forward. And then bring yourself forward, keep your hands up, and bring yourself back. Let your hands come forward and lift, and bring yourself back. Forward and lift. And I want you to feel here what happens when you move yourself forward. You bring yourself into your lower body, your hip flexors activate, your quads activate. And then the upper body is active because you're pushing out, so you're strengthening more muscles in that upper body. On the next one, we're gonna come forward, bring your hands forward, lift your tushy up off the chair. Then I want you to push your legs back, squeeze your block, tilt your pelvis by squeezing your tushy, point your tailbone down, and lift your hands up. Keep your arms straight, push out on that strap. If you can lift your toes up, lift your toes up. If you can lift your torso up and bend deeper in your hip, do that. Try to find something. Have your head looking forward a little, push out on that strap. Push your belly button towards your spine to protect your lower back. Let your tailbone point down. Take one more breath. And then you're gonna sit down. So push, you could look back to see your chair. Keep your hands forward and bring yourself down. Take your props off to the side. Catch your breath. So I'd like to share with you, something that is really supportive of posture. It's to support your posture with a block. So take a block, it could be a pillow, could be a rolled up towel. Now when posture breaks, it breaks right behind the heart. That area of the spine is where there's a lot of tension. And then we compress the front of the spine. So we're gonna take the block and put the block right back here behind our heart. So side to side like this behind your heart. Bring yourself forward in your chair and take the buttocks back one at a time. Don't go all the way back to the back of the chair with the lower body. And then bring this block and put the block back behind your heart. You might need to move your pelvis forward with this to see how it feels. I'll show you the side view of this. This is actually something that those in my chair class really love to do this. When I drive with something behind my spine here. When I sit sometimes, especially for long periods of time, I'll do this. And this is very supportive posturally. Now the next thing would be to have your elbows underneath your arms, palms up. So when the elbows are forward, they bring the shoulder joint forward and they contribute to rounding the spine. So if you have your elbows underneath your shoulders, you're setting yourself up for this nice shoulder position and not putting extra tension in the shoulders. Close your eyes. And when you close your eyes, find alignment in your body. Your elbows are underneath your shoulders. Your palms are up. Push your head back. Tuck your chin slightly so that your chin is parallel towards the ground and not pointing up towards the sky. And then do a little body awareness here. Your head on top of your torso, on top of your pelvis. There are oval openings that we could find alignment in to find postural alignment. Bring your awareness to your seat. You're sitting on an opening at the base of your pelvis. There's an oval opening at the base of your pelvis. Align that with the oval opening of the top of the pelvis. Then your rib cage has two openings, bottom and top. So now align the bottom oval opening of the rib cage with the top oval opening of the rib cage. And find that alignment between the pelvic openings, the bottom, the top, the rib cage opening, bottom and top. Feel it in your body. With your eyes closed, you could turn up the sense of feel. Now bring your awareness to the base of your skull, another opening. And find the alignment, the base of the skull, the top of the rib cage, bottom of the rib cage, top of the pelvis, bottom of the pelvis. Feel that in your body. Feel what this feels like. Take one more breath, aligning the ovals. Base of the pelvis, top of the pelvis, base of the rib cage, top of the rib cage, base of the skull. And go ahead and open your eyes. So putting something behind your spine can be a really nice way to bring relief, especially if you've been sitting, standing for a long time. This could be a great way, and then for you to feel that. Work on alignment. Postural alignment is what's going to keep us very healthy in our spine and be able to do stronger work when it comes to all the other components of our bone health. And we want to minimize compression fractures because that's the beginning of the end for many. Once you start to break your spine, which can happen if you don't pay attention, that can lead to more breakdown internally with the spine, and then that can lead to hip fractures. So take care of your spine, very important part of bone health. So let's come down onto the ground and allow that integration into our body of what we did today. We have the chair. It would be nice to use the chair. Blanket if you need. So any way you would like to end the practice is for you. This may be a little different than we're used to, but nonetheless, very important for spinal health, for bone health. Gently begin to deepen your breath. Start to bring movement into your fingers, your toes. Draw the knees a little closer, rocking side to side. Come onto your side. And here, keep your head in your arms so that you could push away with the elbow, push away with the hand to bring yourself up. We'll close the practice with sound. Sit in whatever position feels appropriate for you. Take your hands together, rub your hands together, press your hands to your heart to your hands. Lengthen the back neck, tuck the chin down towards the chest. We'll close with a gentle humming sound. Take an exhale. Inhale deeply. Bringing your hands up, bowing in gratitude. Namaste. So I'd love to hear how that was for you. Not my typical lots of postures, lots of strength, but rather a lot of body awareness, because that is super important. And I don't want you to get to a point in your life where you can't practice anymore, yoga or anything else, because you've had a lot of issues. So I teach 5 live classes a week, and one of the classes I teach is a chair class. And that's very much like the chair class that I teach. And I feel like I get the most posture work in a chair class. And so hopefully, I know I have a lot of strength in my body. I felt that whole thing. I still feel my back muscles sore from today's practice. So a slower practice like this, you can still do a lot of work in it and create strength. So I'd love to know. Great. Good. And Kendall, no wrists, yet wrists. So even though I don't know what I thought I was going to do in the beginning. I don't know if I thought the whole thing would be in a chair. I thought we probably would come on the ground, and I was thinking, how am I going to modify? But a lot of the work we did today, Kendall, when you're doing that posture assessment and pressing your hands against the wall, whenever you're doing side stuff, I was a lot of lateral work today. And I said, have your hands to the wall. Try not to bend them like that. That's going to strengthen the factors that strengthen our wrist. So that actually can be really beneficial for you as well. Great, Carolyn. You're welcome. So perfect. All right, ladies. Well, it's nice to have those practices as well, right? Not everything has to be that we're standing up. If you like this practice, give me a thumbs up, please. Subscribe to my channel if you're not subscribed. Share this with a friend if there is someone that is, I just got an email today from some woman that her doctor wants her to go on medications. She's so scared. Every appointment she goes to, they're pressuring her to go on medications. And so I told her, you've got to come to this talk that's happening today with Andy Bush, Dr. Andy Bush, orthopedic surgeon. We're talking about medications, and we're going to give you materials to share with your doctor so that when you go in and say, I don't want medications, or wait a minute, what are all the side effects? And what's my commitment once I start one? How many years am I stuck? Because if you stop those meds, some of those, you actually will increase your fracture risk, which is so crazy because that's why we're doing it in the first place, right? Wrong, because a lot of these medications don't prevent fractures. So educate yourself, ladies. And that's what I'm here to do. Education and empowerment is my platform. All right. Thank you. I'll see you when I see you. Bye. Have a great day.